Hello and welcome to the topic Screening Tests in the module Clinical Sciences. By the end of this topic, you should be able to define and describe screening tests, explain sensitivity and specificity with interpretation, and explain positive and negative predictive value with interpretation. Let's get started. First, let's define and describe what are screening and diagnostic tests. Screening is the systematic application of a test or inquiry to identify individuals at sufficient risk of a specific disorder to warrant further investigation or direct preventative action. This is done amongst individuals who have not sought medical attention on account of symptoms of that disorder. Screening patients for preclinical disease is an established part of day-to-day medical practice. Routine recording of blood pressure, urine testing, and even preoperative chest radiography may all be regarded as screening activities. Increasingly, screening is now being extended to people who have not themselves requested medical aid. A diagnostic test determines whether or not someone has a disease. However, do bear in mind that tests are not 100% accurate. Next, let's explore sensitivity and specificity. Before that, there are a few terms to clarify. A true positive. This refers to the number of patients with the disease and have a positive test result. A true negative refers to the number of patients without the disease and have a negative test result. A false positive refers to the number of patients without the disease but have a positive test result. And finally, a false negative refers to the number of patients with the disease but have a negative test result. The likelihood ratio for a positive result refers to the increase in odds of a disease when a test is positive. Its formula is sensitivity divided by 1 minus specificity. On the flip side, the likelihood ratio for a negative test result refers to the decrease in odds of a disease when a test is negative. Its formula is 1 minus sensitivity divided by specificity. Let's go over an example. Here, you can see that 100 people are tested for killer sneezes. Out of this 100, 10 actually have it, one of whom is not detected by the test. Out of the 90 who do not have the disease, 18 still show up as positive. So as you can see, it's not a great test. Now let's move on to contingency tables. This is often known as 2x2 tables and are used to illustrate and calculate test statistics including sensitivity. With that out of the way, sensitivity, also known as true positivity rate, is calculated by dividing the value for true positives by the sum of true positives and false negatives. With that out of the way, sensitivity, also known as true positivity rate, is calculated by dividing the value for true positives by the sum of true positives and false negatives. Calculated sensitivity can be interpreted as the probability that a patient with the disease will have a positive test result. The sensitivity of a test is how sensitive it is to people with the disease. Specificity, on the other hand, or the true negativity rate, is calculated by dividing the value for true negatives by the sum of true negatives and false positives. Calculated specificity can be interpreted as the probability that the patient without the disease will have a negative test result. The specificity of a test is how specific it is at only detecting the disease and not giving a positive result when there shouldn't be one. Moving on, we'll be exploring positive and negative predictive values. The positive predictive value is the probability of a patient actually having the disease if the test is positive. It can be calculated by dividing true positives by the sum of true positives and false positives. Moving on, negative predictive value is the probability of a patient being free of the disease after a negative test result. This can be calculated by dividing true negatives by the sum of true negatives and false negatives. Let's go over an example. As you can see here, the test has 90% sensitivity. This means if you have killer sneezes, there's a 90% chance that the test will come back positive. You can think of sensitivity as how sensitive the test is at picking up the disease. The test over here has an 80% specificity. This means if you don't have killer sneezes, there's an 80% chance of it coming back negative. You can think of specificity as how specific the test is at picking up killer sneezes. For example, a test with a low specificity would come back as positive if you had any of these, either killer sneezes or even killer coughs. This test here has a positive predictive value of 33%. That means that if you get a positive test result back, there's only a 33% chance that you have killer sneezes. This is actually very low. The reason it is low is because killer sneezes are so rare that a positive test result is more likely to come from a faulty test on one of the many people without the disease. The negative predictive value is 99%. That means that if you get a negative test result back, there's a 99% chance that you do not have the disease. The example shows that the negative predictive value and positive predictive value depends on how common the disease is in the population. If the disease is very rare, it's hard to separate out those who really have it from the false positives. Hence, the positive predictive value is low. However, sensitivity and specificity are not affected by how common the disease is in the population. They are properties of the test itself. To summarize, screening is the systemic application of a test or inquiry to identify individuals at sufficient risk of a specific disorder. Sensitivity refers to the probability of the patient with the disease having a positive test result. And on the flip side, specificity refers to the probability that a patient without the disease will have a negative test result. The positive predictive value is the probability of the patient having the disease if the test result is positive. And finally, the negative predictive value is the probability of a patient being free of a disease after a negative test result. We have come to the end of this topic. Thank you for your time.